In the West, I have seen that if the chlorine goes above a certain level, zero point 0.1 ppm, they immediately shut down the unit till the issue is resolved. And water plays a very important role. Do we also do such things in India? I mean, I remember doing it in my unit, but I'm curious about other units. Do other units also do these practices?
Yes, we do the same thing. Even we will have the system where every day morning once we developed the tool that is like a self-assessment checklist tool we have developed, where the senior technician, the in charges, or the staff once enter into the duty on the morning. So they have to go for the rounds in the system, the facility rounds they have to go, and they have to fill the checklist. So whether everything is in place or not, the water TDS levels, the electricity, the DC, including it is not only the electricity, the alternate electrical power sources are working fine or not. So everything they have to go for the facility rounds in the dialysis center itself, and they have to fill the checklist, including the emergency equipments is working fine or not. First they have to complete this checklist, then only they have to start the operations of the day. So
Okay, that's nice.
so it should not be like once the operations has been started, then something goes wrong and they should not shut down in between and all. It will interrupt the services.
Correct.
So that report they have to update before starting the operations of the day. That we will go through that. If any major things are there, then we will, like as you said, if there is any abnormality in the water levels or something, then immediately we will stop the services and we will hold on. We will inform to the patients, then we will arrange alternate water source, then we will continue the services.
You said that you are in charge of quality, right? And you also go and audit your units.
Yes.
So there are two levels of audit. One is what you do, and you also faced an accreditation audit. So which was more dangerous? Is your audit more dangerous or is the accreditation? Jokes apart, you also do audits, I know that, and as your internal audit process. And can you describe what internal audits do you do, and how do you go about looking at a unit when you visit it?
Our audits will be, basically every organization have the annual operating plans. Basically they are having the AOP, that is annual operating plans for operations, for R&M teams or for financials. But in my organization, along with all other departments, we are having the annual operating plan for quality also. So we have defined the complete each and everything, like every month. So how many audits, which clinics we have to do audit, and quarterly basis how many units we have to complete, and what type of internal audits, how many internal audits, how many half yearly audits, okay, how many 360-degree surveillance audits need to be done. So everything will be predefined with timelines.
Wonderful.
So accordingly we will the team, basically even we will do audits on daily basis, virtually. So virtually we will connect. Yes, it is, yes, because we can't visit every clinic on every day, so we have to better use the technology to ensure that safety is in the place consistently in every clinic. Wonderful. So that's why. So that's why we will do the virtual audits randomly for selected clinics every day to ensure that things are in place. Then monthly the quality, my team and me along with me will visit minimum these many clinics. We will fix the schedule that every team member has to visit minimum X number of clinics has to visit per month. Basically we planned minimum 8 to 10 clinics we have to visit per month. Every quality team member has to visit 8 to 10 clinics. Then half yearly once we will have to do one 360 degrees surveillance audit, complete complete as per the same, similar to accreditation. We will do half yearly once audits in every clinic. So yearly 2 audits. Then if is there any accreditations, if we are going for any accreditations, then accordingly we will plan and we will do more audits. We will do more frequent visits to the clinics and we will guide them, and we will do regular audits to the particular clinics where we have any accreditation things.
So I think your two units have gone in for accreditation and they have received the accreditation.
Yes.
And congratulations for that. Your team worked very hard for this, I think.
Yes, yes, yes.
Yeah.
So it is not like internal accreditations. So external accreditations is also much useful for any organization, because self-rating is different thing, but the rating has to give by the third party. It will give the real scenario, which will show up where we are exactly and where are the chances to improve.
So external validation is always important, and your team really worked hard. I could see, and I appreciate what you're doing. Okay, but with this now, let's go on to a lighter tone, and I'm going to say hello to you in Telugu. Yella enaru. And I want you to tell me something in Telugu which I won't understand, but maybe some of your viewers will, some of our viewers will.
So it is like yeah, I mean anta andaru bagunnaru means all are fine. All are fine in Telugu, it is like andaru bagunnaru.
Okay.
Good.
And you are famous in your unit, I think, for certain things. Can you share with us? You were saying that whenever I make presentations, people tell me that I focus
Yes.
on quality and things like that. Can you tell me something about that?
Because once I started this comes into this completely to the quality field, then I impressed with the numbers. Then I am eager to show it in different way, the my present, because the way of I mean, see how much, if example, if we will go to the restaurant, whether we don't know whether the food will be good or not, just by seeing the rating or just by seeing the reference of our friends, we will visit to some of the famous restaurant. So we are having some expectations or without expectations once we will enter into the restaurant. So we don't know how the chef will cook, how the food taste will be. So but the way of presentation, once the food comes to onto our table, it will attract us. It will mentally prepare our mind that yes, the food will be good, because the way of the I mean the decoration they made in the plate. So everything will prepare our mentally, then automatically we will go to the positive note that the food will be good, then we will taste it, then it will give the pleasure to us. Yes.
That's right. That's right. I know when you walk into a unit, dialysis unit, the entire ambience of when you walk in, the sounds, the sight, the smell, everything that you are seeing visually, it has to be appealing.
Yes, the first impression is the best impression, the quote we can handle. The same way when it comes to the then the same way it comes to our data analysis and our presentations too. So I try to do the presentation in the better way every time to impress the viewers. Once they need to show interest to listen what we are going to tell, they have some excitement, so that yes, so that way I will present use the different modules of the slides, the presentation, graphics and all in well, presenting the data, so that even not only the presentation makes interest, even they can understand it in better way. Yes, why the this data metrics is much, so this is what really happening in the ground level. So they will understand it in better way, and they will show interest to become part of it, to improve that graphs levels. Yes, now this region my graph level is less and another region graph is in high. So the people will show interest to improve their graph level also. So that voluntarily they will come and show interest in doing the things.
Yeah. Nice. So you are a real icon, and I appreciate you coming on this show. And I want you to finally tell youngsters who are joining this field, what is it that they can look forward to, how they should progress, what should they plan in their careers, what is it that made you stand out amongst so many people, so that in a short span of 15 years you achieved so much. What would you tell the youngsters today?
So basically, the first of all, the technicians has to understand that the dialysis means it's not about just doing the priming, cannulation and termination. It's no more any standardized care in dialysis. Now it should be like an individualized care. So we have to treat every patient is a unique and individual, and we based upon their patient's condition and their comorbidities, we have to be deliver the care. So this first point they have to be keep in mind once entering into the field. Then the second thing is they have to understand that for every dialysis patient, The dialysis center itself is like a second home for them, because nearly in every week for more than 12 hours they will stay with us.
Yes.
For every alternate day, whether they will go to their relatives home or not, but every alternate day they will visit to us, to our
Away from home.
yeah, so they will come to us.
Yes.
So we need to treat them with empathy, we need to take care with them and their members with emotional touch. We have to give, and we have to give support them psychologically. We need to understand them. Okay, so all these things we need to keep in mind, and we have to do the patients with empathy, much required nowadays, because psychologically they are depressed. So that's why the technician has to take them as a family member, and we need to treat them with empathy. That is much required. It is not like just I am doing the job. So it should not be like that. So that is much important that they have to be keep in mind. Then and most important thing nowadays, the technicians also need to upgrade their skills in multiple aspects, especially it is not only on the clinical front. In clinical front they have to upgrade, that is also like they have to be improve their skills in doing cannulation, how to maintain the RO plant. There are a lot of female technicians are also emerging in the field, so they also should keep in mind that either it is a nurse or it is a female technician, they should not think that the RO plant means only the male technicians will handle. So our part is only to do filing work and do cannulation. It should not be like that. So they also need to learn each and every aspect in dialysis, how to operate RO plant, how to do loop line disinfection, how to prepare acid bicarb. Everything they have to show interest, and they have to learn all these skills. And also they have to learn in-depth knowledge about the, even at the same time the male technicians also need to learn about the importance of documentation, how to write files. And they have to, every technician need to learn about the handling emergency equipments, because the technology is changing every day. The similar applies to the medical field. The missions are upgrading, the dialysis missions are upgrading with more features to do the better, to deliver the better dialysis to the patients. So we need to upgrade our skills in learning these things. It is not like once I got the certificate, now I became technician, so no need to study anymore. So once we stop studying, then our growth or progress will end there. That they have to keep in mind.
Very true.
Very true. Very true. So that's the thing, and they have to grab the opportunities in the field. As earlier you asked me how within the 15 years how I progressed to this much position. So that the technicians who are coming into the field, they need to understand that see, we don't know when the opportunity comes to us, but we need to equip ourselves ready to grab that opportunity when it comes. So for that they have to learn more skills related to the tech, like the computer skills, the Excel skills, the presentation, the communication, and everything, the team management. To become the unit manager, we need to handle the 30-40 patients, and we need to handle a team. So we need to have the team management skills also. So all these things they need to be upgraded in all these aspects. And finally they need to be, because every hospital now they are going for the accreditations, so they need to understand the importance of the accreditation, and they have to learn more skills. What are the standards in the dialysis? As per the accreditation standards, what are the things they have to be focused? Either it is infection control, quality control, and data analysis. And it should be like an ongoing process. Every day we have to learn something. It is much important to stay updated.
Very nice. Actually, in our Nephlearn YouTube channel, we have videos on these topics: reporting to a manager, communication skills, counseling of a patient who refuses to follow nutrition guidelines, and so many other topics like these. So I'm glad you brought this up also. Actually, what you are saying is very in tune with what we believe in at Nephlearn. So that is why I'm very happy that you're here on this podcast with me.
So because the role of a dialysis technician is changing nowadays, they are not only technician anymore. They have to play the all-rounder role. They have to manage. They have to, as a manager, they have to do the things in the center. as a unit in charges and all, they have to manage, and they have to maintain the, as a stockist or the procurement department, they have to handle the stock management in the center, which consume, because that's majorly plays the key role for the organizations. If anything goes excess consumption, it will keep the company under losses. So the profits and loss, the business, everything we need to keep in mind as a technician. It is not like only one aspect.
So, Sagar, in this last question to you now, your journey has been exemplary, and you have given so many new tips to youngsters that they should what they should look at and what they should excel in. Tell me, would you, along your journey, like to say thank you to some people who maybe mentored you and gave you the direction that, okay, Sagar, this is the right way to follow, or why don't you try this opportunity? Would you like to say thanks to anybody, or
Yes, yes, absolutely. That is a thank you for making me to give the opportunity to thank my mentors once again through this platform. So,
Yeah.
see, from when starting my career, so I mean, every stage we are having some mentors who motivates us to progress in our career, either it is professionally or personally. So, in one of such thing, when it comes to us, to me especially, then the first of all, when I starting my career, there is one person who is called Ravindra Babu. So, who is when I am in the student period, he is the senior technician for the thing. So, might be because of him, I came through this journey into this field. So he guided me. So I learned a lot technically and clinically through him, and how to be like a, so how to, I mean, maybe the skills what today I'm teaching to my juniors, how I'm behaving, maybe everything I seen and noticed from him. So this is how to be like a senior technician means the superior means we need to be like this, we need to guide our team like this. So these things I learned from him, and I'm following it. Then there is then in the later stage there is Sheshidhar. So Sheshidhar. So when I enter into this quality thing, then he is guiding me. So how we need to do the things, how to train, how to I mean how to mingle with group of people, how to handle different people, because all people are not equal. So we need to, yes, so we need to manage the team. So we need to sometimes, even though if we won't like, we need to pass on, and we need to change ourselves, and we need to move on by seeing the positivity. So that is the thing. And in the later stages, the in operational levels, there are many people will be there. And now in the, when comes to the current scenario, now the my COO Mr. Sudhakar Rao, so he is like I mean, I can say in simple way, he is like a good boss. So what we call the boss means like that encouragement he will give to us at every time. Okay, so either it will go wrong or right, he will encourage every time to do something better and to deliver. Always he will talk about the quality. That is the best thing I can like, because we need the superiors also need to take the importance of quality. Then only we can do much better things in the field. So I'm lucky to have the boss who is the COO like that, who is always talks about the quality. And finally, the my great mentor, who is currently my the boss in the quality, Mr. Gaurav Loria, who is the group quality head in Apollo. So see, he is always encourages to bring it is, I mean, to diversify the field, to who, because of whom only we will think of thinking in different ways to do it in better way. Even though the dialysis is a small thing, a small clinic when we compare it with hospital, but he will always encourage whatever we are doing in the hospital for 500 bedded or 300 bedded hospital, he will always try to do the implement the same things. Even you will consider the dialysis clinic as a hospital and do the things in the dialysis clinic, so that it will improve the patient, so it will increase the patient satisfaction levels, and we can deliver what the customers are expecting from us. So and especially this data metrics, annual plan, the presentation skills, everything, because of him we are upgrading our skills continuously day to day.
I'm sure Apollo is very happy with your work, and I'm sure you seem to be very happy with Apollo also. And it's a wonderful partnership that you have there. And I'm glad to hear that the same standards which are for the 300, 500 bedded hospitals are also applied to the smaller dialysis clinics. And it's wonderful to hear that.
Yes, and finally, I would like to thank all my technicians, nurses, my colleagues.
That's right. They
Yeah,
listen to you
my
for your
supporting,
amazing
yes,
guidance.
all my supporting team members
Yes,
of every department
that is true.
and my quality team. So who is in front of me? They are there who is doing executing the things, because see, planning is not much matter. Everybody can do the plannings, but the execution is much important to see the result.
On the floor,
Yes, on the floor, ground level. But the people who are following these, the protocols, the new initiations, whatever we are introducing every year in the field, the ground level team is taking it in positive note, and they are trying hard to deliver the best service to our patients.
Correct. So I'm very happy to hear that. And with this, we'll end our interview. And a very big thank you. Sagar, if you were here in Nagpur or I were in Chennai, I would have given you a gift hamper. But right now, I don't have a gift hamper for you. I only have best wishes for you, your units, your entire teams.
Thank you.
And I wish you good luck in the future and hope you do continue to do
Thank
so
you.
well. And I hope you become a mentor for somebody down the line. Not
My
somebody,
team.
many bodies. So with this, we'll end the interview.
Thank
Thank
you
you
very
very
much,
much.
madam, for this opportunity. It's nice sharing with you all my experiences. It is good platform to share my experiences through you. So
Thank
it's
you.
good, and really I appreciate the your initiative of taking this Nephlearn. And it's lucky for me to meet you as I mean, as one of the QI assessor. So it's I think now it is, I'm feeling more lucky now to meet you, to do all these sessions, and what the initiations you are taking to upgrade the skills of dialysis technicians
Thank you. Thank you for
through
the
your videos.
compliments.
So we are even me to pass this YouTube channel links to our staff also, and we will encourage them to go through it
We
and
are
learn.
coming out with a new course on May 6th, which is on clinical emergencies in dialysis, conventional dialysis, not CRRT. So,
Okay.
yeah, it will be like hypoglycemia or even hypotension, hypertension, but in details. So, an average technician would also know why this is happening and how to tackle it and how to avoid it, most importantly. With this, I think finally we'll close and thank you once again.
Thank you, madam. It's have a nice.
Bye. Have a nice day. Yeah.
Pour some wine, pop champagne.